So today we're going to talk about core ethical principles guiding research. These in particular are the APA Ethics Code and the Belmont Report. And so we're only going to be focusing on those two things today in this video. The Belmont Report focuses on three different things in general. They focus on respect for persons. So in particular, informed consent. So do people have the, actually consent to the research? Do they know what they're consenting to? And are they being told the pros and cons? That's certainly something that we would wonder about the Tuskegee syphilis research. Principle of beneficence. So what potential harm is there to participants, and what potential benefits to society? And so you can imagine that we would be weighing those back and forth as we were talking about Milgram's research or Sharif's research, for example. And the principle of justice. So who bears the burden of research participation? And are they actually also getting the benefits of participation? So in general, if there's low risk and high benefit, then we're going to do the study. Just easy. And if it's low benefit and high risk, then clearly we're not going to do the study. But some cases are going to be more difficult, where we don't, where there's high benefit, but also high risk. So for example, the Zimbardo prison study the Stanford prison experiment could be considered this sort of research. And then, maybe there's low risk, but there's also low benefit. And a number of articles will talk about this semester. I don't know. So for example, in the next video, we're going to talk about what happens when people are observed, while men are observed while they're urinating. Does that change the rate of urination? What is there in terms of benefits here? And in fact, I don't think I'm going to talk about it. I think it's going to just be in the PowerPoint. So things to keep in mind here. So let's talk about a study by Kramer et al. That was done in 2014. And what they did is they manipulated 700,000 Facebook accounts by withholding either certain positive news posts or certain negative news posts for a few hours. And then they counted how many positive and negative emotion words people used. They found that people used fewer positive emotion words when their positive news had been temporarily withheld, and used fewer negative emotion words, sad, depressed, when negative posts had been temporarily withheld. So this is a little bit questionable, fair amount questionable. First of all, Facebook users did not consent to having their accounts analyzed. They agree to this when they sign up, but they didn't necessarily agree to this sort of study. So Facebook typically looks at what you're posting, and they decide what kind of articles to give you and what kinds of ads to show you. That's what they're saying. But did people consent to Kramer et al.'s research? Okay. So one question we might ask is, does this study reflect the ethical principle of respect for persons? Did the participants choose to participate through informed consent? Facebook and Kramer et al. Would probably say yes. I think that's questionable. Does the study reflect the ethical principle of beneficence? Was there a balance between harm and benefit? So, the benefit might be that we would know something about how we should present information, and that would impact, the potential mood. And that could have a whole lot of influence on what we do in terms of how we're presenting information and what a news station might do, for example. So some good benefits. Was it worth the risk? What if you had your positive news feed cut back and that increased depression? Does the study reflect the principle of justice? This is our third question. Are the study participants representative of the people who benefit from the research? This one is probably clearest. Probably, the people who are in this study were those who are most likely to benefit from it. They're the ones who are using social media most. Now, this is a figure from Kramer et al. And you see that, in fact, there is a significant difference, so that when negativity is reduced, people are reporting more positive words. When positivity is reduced, there are fewer positive words shown or that people include in their posts. Conversely, when we reduce the negative words that are used or negative posts that are included, we are seeing more, this is our experimental group, we're seeing fewer negative words and more positive words. Okay. Now, what I want you to do here is pay attention to this here. Okay. First of all, these are significantly different. Okay. However, in terms of clinical significance, we're talking about what? A difference of less than 0.1 words difference here. Here we're seeing about 0.2 word difference. Here we're seeing, we're seeing about 0.1 and less than 0.1 here. These are really small differences. And so, now the question is, does it matter that the resulting effect was very small as we're thinking about the ethics? And I think no, because they went in expecting more, right? Now, I think probably what they should have done is been more clear about the size of the change. They're talking about emotional contagion through social networks. This doesn't look like what I would call emotional contagion. Emotional contagion is like, whoa, here's an emotional pandemic. We're not seeing that here. So let's talk about APA ethical principles. It is similar to the ethical principles, or as described in the Belmont report. So, the Belmont report talked about 3 factors: beneficence, justice, and respect for persons. APA ethical principles certainly includes beneficence and non-maleficence. So do good, don't do bad. Okay. Justice and respect for people's rights and dignity. So sometimes talked about as autonomy. In addition, people are thinking in terms of fidelity, so creating trusting relationships, and integrity in terms of being accurate and truthful. If we go back to Kramer et al., what I would argue is, there's certainly some question about, certainly a lot of question about whether people had the right to say no. This one here, in terms of benefits, that's more questionable. And in terms of justice, probably this is safest. But in terms of fidelity and integrity, I don't know, because they are misrepresenting their research, I think, talking about emotional contagion. And that misrepresentation probably is inconsistent with integrity, and it tends to erode the trust between the public and researchers. So things to think about. We're going to finish our discussion in the next video. Take care.